Are you ready to jump into some true crime docs, crime thrillers, and more? Check out our website for an extensive list of our favorite movies and shows at thesirenspodcast.com/whatwewatch and find our favorite true crime and thriller books and authors, some covered on the show, at thesirenspodcast.com/author alley. You can even find special deals for Amazon Music, Audible, Discovery Plus, Paramount Plus, Showtime, and even Grubhub. If you're looking to jump in immediately, check out our pinned Facebook post for some streaming service free trials on us.
You're listening to Sirens, a true crime podcast brought to you by the Sirens Network. This podcast contains explicit content, so listener discretion is advised. The opinions expressed on this podcast are solely the views of the hosts and do not reflect the views of affiliates, associates, or sponsors of this podcast. This is Sirens, a true crime podcast.
Duntsch goes from Baylor Plano to Dallas Medical Center. This is in Farmers Branch until hospital officials could obtain his records from Baylor Plano. But then again, it doesn't matter because
they already got a letter and they already flushed them all down the toilet or whatever. They're all gone.
So early on, however, there are some red flags that surface.
Yeah, like the murders.
Nurses wondered if Duntsch was under the influence of drugs while he was there. For instance, he came to work wearing the same scrubs 3 days in a row. And the reason why they know it was the same scrubs 3 days in a row is because there was this patch torn out on his ass. And
he wasn't wearing underwear.
No, he wasn't.
I know that in my mind he wouldn't have worn them more than once if it was bigger than like a nickel.
I don't know.
I know, but in the way that you said that was like
a whole cheek is showing.
Yeah, like his whole right ass cheek is just exposed. He just walked around doing surgery.
The whole pocket's ripped out.
One of those old pajamas that button and you unbutton them, take a shit. It's exactly that big. Just his whole bare ass.
Oh God.
What a fucking stupid asshole. I could see that, like, if you fell asleep in an on-call room in your scrubs and so the next day you just fucking get up
but
and
no, he's,
three fucking days
he's going home and
you went
back
home and came back like you're a piece of shit.
And I want to mention that Dallas Medical Center, they only did minor outpatient surgeries. So just keep that in mind moving forward. No,
we've seen how all his minor, minimally invasive shit's gone so far.
So, but the thing about it too is that, like you were saying, these neurosurgeons, they're sought after. They can bring a lot of money to a clinic, and they bring their patients with them. So this could be a huge cash cow for this Dallas Medical Center. So they think. So they grant him temporary privileges. Okay, now we're in July 2012. The next patient, Floella Brown, she's 64. Let's just jump right in. So Duntsch, during the surgery, actually severed her vertebral artery.
It goes along the central cord, along the spinal column. So he would have had to go all the way through the bone to get to that. What? Right? Am I right about that? Let me double check that real quick. Also, just so you know, for cash cow purposes, the least amount that the insurance will pay a hospital for a minimally invasive surgery is $80,000. They can go up to $1 million. Just so you know. Oh my God! For each time someone lays on the bed, every time someone lays on the bed.
Hospitals are dealing with millions, billions of dollars.
So they're going to let him fuck up like 9 or 10 more times. It's like $10 million, and then we'll fire him.
Yeah. I did see at one point that he was getting like. The clinics that he was doing this at their cut was like $65,000 or something for each surgery.
Oh yeah, okay.
Yeah. So he severed her vertebral artery. After this, of course, she's bleeding out, and he refuses to abort, despite the blood loss.
So this is just for you to look, just to see it, just so you know what we're talking about here.
Yeah.
That's where the vertebral artery is. That's how far into the bone it is.
Oh, damn.
So that's not something that you nick because it's just right there in between and you could have missed it. You've got to cut all the way through that bone.
It's in there. It's in there. So the staff tries to tell him that Floella is losing blood. We've heard this song and dance before. But this time, there was so much blood loss that it was actually pooling on the floor. And the techs were like scrounging, trying to clean it. Yeah, it was a nightmare. This was your nightmare OR scene. There was blood everywhere. So,
do you know how much blood has to come out of a person that a suction canister can't catch it?
Yeah, and how fast.
Wow.
Yeah.
Some of those Ducantos can do 50 ml a second.
And the dumb part is that when Duntsch is in there doing his surgeries, at one point he's even inconvenienced by this blood loss going, I can't see, there's so much fucking blood. Somebody get in here and get this blood. But he does nothing about it.
That means, holy shit, that's a really good point of view for your argument that he's playing. Yeah. He's mad because he can't see what he's playing
exactly.
with.
Yes.
He can't see what he's playing with. Somebody's interrupting. That's like if I stood in front of you watching TV on Super Bowl Sunday. Yeah. He's mad because he can't fucking see to play.
And he acted like it was an inconvenience, and he wanted someone else to clean it up so that he could continue playing. Yeah.
This dude's a fucking monster.
Yes.
But it's hard to believe that there are people like that. So I can see that people were like, I don't know.
Yeah, you don't want to believe.
Because you don't want to believe that.
Standing in an office every day with fucking serial killers.
Yeah. Again, instead of trying to figure out where the bleeding was coming from or doing anything about it, he again packed it with anticoagulant.
No, it's
stop giving him that stuff.
I'm curious about this joke. So that's the second time he's used it.
I don't know much about it because that was out of my scope, completely out of my scope.
It must be pretty. I mean, a common.
Are you sure it wasn't like a quick clot paste?
It was
to make clots.
It was called an anticoagulant gel foam.
You're meant to use those. So the vascular surgery, you know what I mean? Like, they put them on sponges for surgery sometimes. And so, like, if you nick an artery, then they'll clamp the artery and they'll put that sponge right in front of it. And then it prevents the blood that's hitting the end of the pipe from making a clot and going back.
Gotcha.
Okay.
So I get that now. Okay, I was like, why the fuck is he just packing this tissue with it? That makes no sense. But it's because he's like, all right, they're going to have to fix everything I just fucked up. So he's spraying this foam in there and going, there you go.
Oh, my God.
But I mean, it's meant to be used in like small dots. Like, imagine decorating a cupcake. Like, that small of a dot.
God, you're so slow.
So the vascular surgeon could come in and look and go, oh, there's a dot right there. I got to get in there and figure out what's going on.
And so
he clamped a fucking artery.
Suction it all out before they can
just
do anything.
Putting like a fucking lump in there with a piping bag and just blah, blah, blah. It sounds good. That's him kind of in a weird
getting
like
in their
Freudian way.
Yeah,
getting like just going. Good luck finding what I fucked up, right?
Yeah,
I fucked all this up. Good luck.
So it's called Surgifoam.
Yeah, I've heard of Surgifoam. They put it on sponges. Yeah, they put Surgifoam on sponges, and actually we have one of those in our cricothyrotomy kits.
Yeah,
a little in case
very cool.
Fuck something up. Well, I mean, you fucked up a cricothyrotomy. You do not belong doing medicine to anyone ever again. So
stop it.
Cricothyrotomy is easy. There's literally no muscle tissue between the skin and the trait.
I'm going to show Bill what this looks like.
Take a look, Bill.
That's what they are.
Like
they look like, yes, thank you. They look like a magic eraser.
Oh, Bill.
And
God damn it.
They do. I never thought of that, but they do look like magic eraser. I'll never look at a magic eraser the same.
And closes it and leaves it. So, because...
Probably would have been better for her to put a magic eraser in than this fucking dipshit being to touch her.
Because of all the bleeding, Floella actually suffers a stroke. Hardware is also left inside of her.
Interesting.
Yeah.
So that means
what do we mean
that
by
he
hardware?
didn't even apply the anticoagulant because, like I just said, the anticoagulant's meant to prevent strokes from clots forming in the end and then traveling back through the vascular system.
A
stroke is a blood clot touching your brain.
It's almost like he's like, I'd rather her die than you guys be able to come in here and fix this fuck up, you know?
Yeah. Well, because, like you said before, he's completely dissociated from their object state. That's his toy.
Yeah.
And he's done with his toy. Like a child throwing it in the floor when he's done. And shattering it so no one else can play with it.
I think at this point he knows, like, he's gonna get in trouble. He's gotta, in the back of his mind, know at this point. I don't know.
But the voice in the front that's telling him you're untouchable.
Like, if he's
too
doing
much fun.
Dude, yeah, he can't stop.
It's too much fun.
He can't stop.
Yeah, it's an addiction now. So she actually survived and woke up after surgery.
Yay.
She said she felt okay. She had visits from her husband, her son, her granddaughter that night. But by 5 a.m. the next morning, she was convulsing and she lost consciousness.
You tricked me. I thought she was going to make
I tricked you. So they tried to get a hold of him all night to tell him that his patient is crashing.
Oh my God.
He was busy.
Please tell me he was laying on his sofa just lit.
He was hooked up with Jerry's drug dealer. Yeah, probably just fucked up somewhere.
He's just laying on the couch.
I don't remember why I didn't include this, but there was some point in which he got into a small car accident and then just like drove off.
So sociopaths have kind of a problem following the law. So sometimes they'll have like minor things like stealing or traffic accidents or something like that. I'm sorry, I'm really bad at this. So I can and they're also predisposed to doing drug.
They want to get in trouble?
I don't know if they want to get in trouble. They just when you think like you're above everything, you can't help. You're gonna do things you're not supposed to do. Yeah.
Okay.
So you're saying that his understanding of the world and the actual rules that exist, they
don't apply
coincide.
to him. Yeah,
Right.
exactly.
Okay.
Exactly. So
That's so crazy.
yeah.
So they try to get a hold of him all night. He's like on some bender, something like that. He doesn't respond to any of the messages. And he comes in the next day and he schedules an elective surgery for a woman named Eford. Her last name Eford, his next patient. We'll talk about her in a minute.
How soon after this one? Did he schedule it like
the
back
next
to back?
day.
So I think he knew.
Yeah.
I have to get on as many of these fuckers as I can
Yeah.
before
Because they're about to shut me
they're
down.
about to shut my shit down. Yeah.
Yeah, because when he got to work that morning, he was actually met there by staff and was like, you got to come in here because she's going downhill.
Damn it, I thought you were going to say they met him and they were like, don't come back. No, that's
Don't ever
complete
come back
opposite. Come in here and help us.
Yeah, so when he was met by this staff,
I'm baffled.
he like didn't even acknowledge what they were saying and kept telling them to schedule an OR for Eford. Like no acknowledgement whatsoever.
Right, he's done.
He's done with that. We're doing this now. Yeah. And so this would be his third day. His third day at Dallas Medical Clinic. That's it. His third day. He was late, by the way, when he got there.
Jesus.
I'm sorry, that's my favorite part.
Yeah.
You can't even murder on time. You have to hear.
Yeah. So I have a quote here from Kyle Kissinger. He was a nurse that met him that morning to tell him about Brown's condition. He said, quote, "The moment he walked in that morning, I immediately got to him and said, look, you need to call upstairs. There's something wrong with your patient from yesterday. It was met with very little concern, almost like he was blowing it off." That's straight from the nurse who told him about it. Like, met him there and was like, you've got to go. She's going downhill. And he was just
nurse,
like, but have you scheduled Eford, though?
So that's even worse.
Yeah.
Because nurses are used to telling doctors stuff and they don't care.
Yeah.
Like, they're used to that.
Yeah.
Nurses are used to being like, hey, by the way, the guy in 18 needs you to run a CBC and his CBG, and you're going to need to do, a lymphatic on him. And then the guy in 14 has had a seizure, but he's maxed out on Ativan, so we need to figure out another benzo for him. And then the guy in 11 has a dip in his blood pressure, but we've already got him on all the beta blocks we can get. And then the doc will pick one of those and go, wait a minute, who maxed him out on Ativan? And so he's used to him blowing off 2 or 3 things. But for a nurse to be like, all right, I told him one thing. I gave him one room to go to.
Yeah.
And he told me to go fuck myself and to schedule this other lady.
Yeah.
That means that it was over the top. So I have to imagine that Duntsch was just like literally arms down like a child going like,
Yes.
what is
and according to the staff, it was so bad, like her condition was so bad that they begged him to transfer her, if he wasn't going to do anything, to transfer her out of his care so that they could find somebody who would.
wow.
And he was still so concerned about
staff?
this other a bunch of staff that were
Like more than 4 people were like,
More
all
than
right,
four-
look, man,
yeah,
if you're not going
more
to do
than 4
anything,
people. Yeah.
like I need to call a grown up.
yes.
Holy shit.
So we're going to talk about Mary Eford. She was 71. This is July 2012.
Oh, Mary, I remember Mary.
So Mary is the one that he kept trying to schedule instead of deal with Brown. He schedules her elective surgery, it required, this is a weird surgery that required constant x-rays because they're placing screws in a certain place where they literally had to click it and he could look and see where he was. Click it, look and see where he was. Okay. So have you ever seen an x-ray before, Bill?
Yeah, I've got an x-ray.
So on that x-ray, could you point out to me and tell me where the bones are?
Yeah. Not specific bones. I don't know bones.
But
No,
you,
but
but
I
you
know
could
the
look
difference
at it
between
and
bone
say,
and not bone.
Isn't that the
This
whole
is a
point
bone?
of an x-ray is
Yes.
to see bones
yes,
versus not bone.
Thank you,
versus
Bill.
not bones?
Yes. Okay. I want you to keep that in mind.
Bones versus not bones.
I'm sorry.
I want
I just
marry
love
me.
the concept of Bill
Those are bones. You see this area here? That's where there's no
surrounded
bone.
by doctors with clipboards going, yes, excellent. He's making notes
Well,
like,
he
well done.
already knows more.
Thank you, Dr. Bill.
Like, already knows more than
backbones.
Duntsch, so.
Clearly, this part is not bone. Because it's
Okay.
not
Nah, reach for
white.
martinis.
So, this requires constant x-rays. You're supposed to be looking up and checking them and placing there. While he was in there, he severed one of her nerve roots
Ow.
during spinal fusion surgery.
Irreparable, by the way.
Yeah.
Will never heal, never repair. Nothing you can do about it. Dead the second it's disconnected.
And that nerve root was in a completely part that he was a different part than he was even supposed to be in.
Good job, buddy.
So it was actually operating on the wrong portion of her neck. He actually twisted a screw into another nerve. He left screw holes on the opposite side of her spine where he had put him in and then took him out and was like, no, that's not right.
Drilled all the way through. Drilled all the way through.
I don't like that. Let me move it.
That looks like
And
shit.
and he
Look, I spelled my name.
Oh, I missed the stud better.
he even failed to remove the disc he was even supposed to be in there to remove.
Like a college kid hanging a poster. Just not there. Oh, there's the stud.
So he didn't remove what he was supposed to remove, the disc he was supposed to remove. He left surgical hardware in her muscle when he was supposed to place the hardware in her bone.
Again,
What?
Bill, if I asked you to cut a pork chop,
Yeah, there's a big difference between bone and muscle.
Yeah, I mean, most of us know the difference between bone and muscle.
Christ.
Yeah,
If
so
I asked you to drill a screw into the bone of a pork chop,
Yeah.
would you be able to tell after you drilled it if it was in the bone or the muscle?
Yeah.
If you drill it in the muscle and you touch it, what's it going to do?
It's gonna move around.
It's going to wiggle around, right? If you drill it in the bone and you touch it, what's it going to do?
It's gonna be solid.
It'll be solid and it won't move.
I'm glad you said that because there were actually, so there was a team in there with him, and that team collectively warned him over and over and over that he was doing things wrong. He never acknowledged them. They said, you're not doing this correctly. You're putting in, places where it's supposed to be in the bone. You're putting it in the muscle. This can't be right. The hardware that was in that muscle, they said, was so loose it just like flopped around in there. And he just left it. He just left it in there.
So another thing about that, we're talking about cocaine.
Right.
Just so you know, cocaine is a fantastic drug for short bursts of high.
And he's expected to have gone on a bender this night before. So
Okay, so here's the thing. Long-term cocaine use has euphoric serotonin dopamine receptor effects. Okay, so they're the drugs that make you feel good, right? So if you use them for too long, then you stop producing those chemicals on your own. Just like anything else, just like alcohol.
Yeah.
If you use alcohol for too long, your body will stop producing thiamine, which it produces in very small amounts, and you need a little bit of it. So enough thiamine deficiency will cause Wernicke's encephalopathy. Wernicke's encephalopathy is a dependence on thiamine without an ability to produce. So if you don't have thiamine in your body from the alcohol, you just don't have it. And then your body will go through all kinds of horrible physiological changes, including status epilepticus, which is seizures that do not stop until you die. So, here's the thing about cocaine. Because you're producing serotonin and dopamine, when you do cocaine and your body stops producing them, you can only recognize that you get those things from cocaine, or you'll associate it with the place that you do cocaine. And in some cases, patients who have been on cocaine for a long, long time will tell you that when they go back to where they used to do cocaine, every time I visit my buddy's old apartment, I don't know why, but I just want to do cocaine.
Yeah.
So I think that he has transferred the high that he gets from cocaine and now associates that same high with surgery. So since cocaine doesn't last very long, but surgery is 2 to 3 hours,
Right.
he's experiencing those same, just while he's doing surgery. Here's the other thing cocaine does to you. Cocaine will dampen the sensory response from your nerve endings to your brain, while heightening the sensory parts of your body that have nothing to do with anything. Some people tell you that just while they're doing cocaine, they can touch their own ear and just pull on it enough that for whatever reason, that one thing to that one guy, that is euphoric, and he can feel that better than anything else. Some people like loud music. Some people like to just drink stuff like water, just the touch of water on their lips, but they can't feel their fingertips. They can't smell anything while they're on cocaine. Their vision gets blurry while they're on cocaine. Colors mean nothing to them. It's different for everyone. Mm-hmm. There's no real studies that narrow down exactly what cocaine does to anyone else, but I wonder if he had been on cocaine for so long, Bill can tell the difference between a pork chop's bone and a pork chop's meat. Mm-hmm. But I wonder if he couldn't. I wonder if prolonged exposure and use, he literally, I mean, he needs to be doing the act. He needs to be drilling into the spine. He needs to have the patient open, their life in his hands. He needs to be doing the surgery, but he literally can't tell what he's doing anymore.
Maybe, yeah. Well, and
but then how you could visually see it though? So
or can he? Can he not?
We don't know.
I mean, is he blurred in? Does he just look down?
Maybe, but
and
then that kind of takes away the narcissist.
Oh angle, yeah, you might be right because again, it's his toy. Well, he got mad when he couldn't see. So I don't know. I
will say that for this surgery specifically, for Eford's surgery, the staff did mention, I will say 98% of the staff mentioned that he had dilated pupils and they thought that he was intoxicated.
Dilated pupils is a very common side effect of cocaine use.
And we're not talking about just somebody going, these are medical professionals. They know what dilated pupils are.
It's our job to tell if you're high.
Yeah. So there were 6 people in the room with them. 5 of them said he had dilated pupils. So
and the other one was on her phone.
Sorry.
So Eford woke up. She was left paralyzed. She later recalled waking up feeling excruciating pain on a scale of 1 to 10. She was a 10 plus. She could not move her legs. And she blatantly said, I don't know what he did to me, but do not let him near me again. She literally said, keep him away from me.
Ta-da!
I would too.
Thank you. Our first person who's like, he did it.
Yeah.
Mm-hmm.
How many patients in is this? 7, 8?
Did another doctor come in and try and fix anything?
So Robert Henderson performed the salvage surgery on Eford. When Henderson saw the imaging from Duntsch's surgery, because they had to take the x-rays the entire time, he was certain that there would be legal action. Like so much so that he would not perform the salvage surgery without it being recorded.
No kidding.
Yeah.
Good on him.
Yeah.
Listen, for a doctor or any medical professional to request being recorded,
Yeah.
that is big time.
Yeah.
That means
I want to make
you're
sure
going to prison, dude. We're going to repeat this to court.
I need to make
this
sure
is going to be on the fucking news.
I need to make sure they know that this was not like this when I got here. This was like this when I got here. I did not do this.
Found her like this. Yeah.
Yeah. So what he found when he opened her up, he said, was like the result of a child playing with Tinker Toys.
Imbot. That's what you said, man.
Mm-hmm.
Gross.
Henderson described his surgery as an assault and concluded that Eford would have been bedridden for the rest of her life had he not done the salvage surgery.
Oh, he fixed her like 100%?
He fixed her.
Yeah, he fucking did.
Yeah. So she required 3 additional surgeries to fix her,
Oh, my God.
but she did get fixed.
Jesus.
So here's some red flags. Some red flags from the video. A surgical assistant says the whole midline structure is just flopping in here.
Midline of the hardware?
That's all I heard, and I've red flagged it. The whole midline structure is just flopping in here.
Wow.
That
Jesus.
That means...
Yeah, what does that mean?
Okay, so when they go to repair these places, there's... and the surgery, again, was...
This is the surgery from Henderson. These are quotes from his repair surgery.
All right, but he was repairing what again on her?
He was
Just remind me
repairing...
real quick.
There were severed nerve roots. There was a portion of her back that was messed up that he had done surgery on that did not need surgery. He had to fix that.
No. I mean Duntsch initially. What was Duntsch there to fix the first time?
What was he supposed to fix? It was a spinal fusion.
Okay.
So all of these are...
So with spinal fusion, we want to guarantee that the vertebra above it and the vertebra below it don't move anymore unless they move together. Mm-hmm. So you got to have at least 2 points of contact, depending on how wide or how disproportionate or whatever landmarks are present on her actual vertebrae. You need to make sure that the hardware that you're using can connect in at least 2 places on both bones. So you need at least 2 screws in the top vertebrae, 2 screws in the top and in the bottom. Now, if it was a spinal surgery that was more than one fusion, more than one vertebrae being fused together, like 3 or 4, then that would imply that there's a midline structure. Or that the pieces are like a door hinge, like more than 2 pieces are connected to here. But to say that the entire midline structure of this hardware, if that's what they're talking about,
it's just flopping in here.
that means he's taken an entire piece of this fusion hardware and not attached it to anything but the muscle.
It's just like hanging out in there.
Oh my
yeah,
God.
and that was the thing.
Which means the bones can still move, and now there's a piece of metal touching everything that nothing is supposed to touch ever.
And that's the thing, is because he did attach it to muscle instead of bone. So another red flag from Henderson's surgery. He says, quote, virtually everything is not done or done in the wrong place. He also says, immediately upon opening the patient's prior scar, I could see a screw penetrating that dural sac from the left side at the bottom. It was just wobbly there. It was like somebody just threw some Tinker Toys in there or an erector set in there. I had absolutely zero comprehension of how this surgeon could think that he had done the procedure correctly.
It's insanity. Yeah. But at least someone... Well, I guess those other guys tried to fight it, but nothing ever came from that. So. Mm-hmm. At least he recorded it. Something.
Yeah. So I have a interview here I'm going to play with the nurse who met with him that morning to tell him about Brown. He's also the one that noticed the butt patch missing or whatever.
Right.
Oh, butt flap. Oh, butt flap.
After this surgery began, I started getting the impression that Dr. Duntsch didn't really know what he was doing. Everyone involved in that case, from the scrub techs to the x-ray tech to myself to the anesthesiologist, gave each other looks many times during that case because we just didn't understand what he was doing. Tragically, what happened in the end is Florella Brown died less than 24 hours after her surgery. The following day, Dr. Duntsch was set to perform a spinal fusion on Mary Eford. I was the operating room nurse for patient Mary Eford as well. As he was working and he started putting in screws which are meant to go into the spine, every single person in that OR told him that's in soft tissue. And his response was, I know where it's at, I can see it, it's in the spine. The next day, a new surgeon was brought in, Dr. Henderson, and he was going to perform a second surgery on Mary Eford to hopefully repair what Dr. Duntsch had done.
When I got to the operating room, the operative field kind of looked like a bomb went off. There was a loose screw that was not stabilizing anything. The screw was penetrating the spinal sac. There was spinal fluid leaking out of the sac. We discovered that the L5 nerve root had been amputated. Discovering what he had done and not done, I was more concerned that he was an imposter, that he was not a neurosurgeon, that he was not a surgeon. He may not even be a doctor. That's how bad this was.
He felt that anyone with a basic knowledge of human anatomy would know that he was operating in the wrong area of Eford's back. I want to say everybody down to an EMT basic takes some sort of anatomy and physiology.
Can't confirm.
So he should have at least known. Anyway.
Bill knows the difference between pork chop bone and pork chop meat.
Yeah. So Henderson, after doing this repair surgery, he actually sent Duntsch's picture to the University of Tennessee because he 100% thought that someone was using his name and his medical license. He sent a picture.
And he was the one using his medical license.
They're like, no, that's him. Yeah, he's a dipshit. We hated him when he was
exactly. To determine whether he actually had a degree from that institution.
Sucks at football, too.
And it was him. They were like, yep, that's him. He called Duntsch's fellowship supervisor in Memphis, as well as a supervisor of Duntsch's residency, just to confirm that it was. He called all of, So it was then learned.
I can't imagine what he found in her back to make him go that far. Think about the other cases we heard where no one did anything.
Yeah.
So what did he find in her back?
That he was like, this cannot stand.
I'm not doing anything till this dude's off.
Or was he the only decent human being?
Maybe. The only one that actually cared about the patient instead of how much money he was getting.
Always forgot
that one guy tried to fight him.
Yeah, that one did.
He
fist fought him. So we got two good dudes.
Hoyle
out of all these people.
And every single other person is a human pile of garbage.
Seems like two extremes.
Well, it is what it is. No gray.
So he called around all these places, and that's when Henderson learned about that incident that led him into the impaired physician program. Yeah. He lasted less than a week there at that facility.
Less than a week?
Remember,
are we counting the end of this day?
Remember, Eford's surgery was on day 3.
Jesus Christ.
He was there for 3 days. Yeah.
Oh, okay, so he wasn't there for 4 days, because
No.
I think I would be like, all right, security, here's a picture of this dude.
Yeah, don't let him back in the building.
This guy walks in here and tase him in the nuts.
Less than a week after that surgery, and administrators pulled his privileges there. Despite both of his surgeries at Dallas Medical Center going horribly wrong, hospital officials did not report him to the NPDB.
God. Okay, there's got to be something else there.
No,
Do we know
here's
how
the
many
thing.
successful surgeries were in between all this?
Here's the
3.
thing.
I read he had 3 successful surgeries.
Here's the thing. So at the time, hospitals weren't required to report doctors to the NPDB if they only had temporary privileges. That's why he wasn't reported.
Oh, okay, because he was on probation anyway.
But
no, I
so
get they're not required, but
there were 5.
Okay.
5 successful surgeries.
And I bet they were in his early days, like when he had to establish that he was good, then he has the name, and then he can do what he wants.
Out of 38, he had 38 surgeries. 5 were successful.
So if he can do successful surgeries,
and I want to add,
incompetent.
I want to add, by successful, we just mean they didn't die or
complain
or get mangled, because because there is one woman we're going to hear from later that he literally fixed nothing. She went in the same she came out. So
I think he just.
Hey, at least he didn't make it worse.
At
I think
least
he just
she
knocked
didn't
me out
die.
and touched my boob and sent me back out.
Yeah, if I was her, I'd be like, I'm alive. I don't care.
Oh, 100%.
Yes.
Yeah, like my leg hurts sometimes, but I'm good.
Yeah, I'm breathing. So
Exactly.
I can still check the mail if I want.
this fucking good.
So after leaving Dallas Medical Center and getting his privileges taken away, he receives privileges at Southampton Community Hospital in Dallas.
All I'm learning here is how broken.
So
I know.
Well, he's going to smaller and smaller hospitals.
Yeah.
So I mean,
Yeah, but he's still just like, hey.
he's going to do everything he can until
Exactly.
he can't
You're right.
anymore.
And at the same time, he also takes a job at an outpatient clinic called Legacy Surgery Center in Frisco.
And what kind of surgeries do they do?
Minimal outpatient surgery.
Dude, that's his fucking MO. Hey, I just want to come in here and do some basic stuff. I just want to do some little tip. Yeah, just the tip of my
So I want to talk about something that Bill said earlier. Like, is he on Yelp? Is there like can we leave him a 1-star or whatever?
Oh yeah, forget about that.
So he did have his own website.
Yeah, he did.
And of course, there were things like Yelp back in the day, but he had employed someone to scrub the internets.
Oh, clever.
of any negative comments.
No shit.
And the only reason we know this is because Henderson and Dr. Kirby were on to him now. Dr. Kirby had done one of the revision surgeries from another one of his patients.
Right.
And they started talking to each other. And they were looking through his website and all this stuff. And they would notice anytime that they would go back, they would see a negative comment. It wouldn't last a day. It was gone the next day.
Tell me that this dude's website plays like right when you go into it, it's just, and it's just him with shades on.
I will tell you that it does play like an infomercial because he made one, and we'll get to that later. Yeah.
How do you feel about yourself if, like, I realize there are bad people out there and they do bad things, but like a doctor, a surgeon comes to you and been like, look, some people been saying some bad stuff about me and like my job because I fuck up a lot. Can you like make sure no one sees that?
Oh, you mean
Like,
the guy that had to scrub him?
that scrubs it.
I
you know?
suspect, because Jerry was in charge of his website and PR, I suspect that Jerry did it. So he was the one putting him into contact with all of these other people, like the person who developed his website and all this stuff. I think that he just went to those people and said, just scrub that.
But I mean, like, that
He'd already made those connections.
Like, all right, if you work like on the internet or something, you don't have one gig, you have multiple. It's not like a person in a surgery room where like, oh, this is my career and I could lose it forever.
Yeah.
Like that I can kind of understand, but like,
it's the narcissistic part of his brain.
No, I get him not wanting them to be there. I don't get the person, like, how do you feel okay? Like someone's like, he paralyzed me. Oh,
you mean
just
like
delete
if he just like presented it differently, like, hey, I'm a surgeon, I can't have negative things on here. They're going to be looking into my social media.
Yeah.
So I need you to go through my social media, and if you see any of these like crazy
Just scrub
patients
it.
that come in here, just delete it.
You're
But how are
forgetting.
you okay? Because
You go read them, and they're
not
like,
a
he
restaurant.
killed my mom,
But
and you're like,
also-
oh,
yeah,
like
how
how
at a
many?
restaurant, you know, it's a
doctor.
surgeon, it's
Yeah.
a doctor.
Well,
I don't know.
he is making $500,000 a year, and he's got a lot of cocaine, so he can pay
That's what I was,
somebody.
that's what I was gonna.
People are
Well
garbage.
done.
World's a
Yeah.
nightmare.
It's
People
just
are garbage.
Yep.
World's a nightmare. That's it.
Okay, so
Okay, I'm sorry, I forgot.
Except the four of
I
us.
forgot that the world's a nightmare.
So he's got some patients after that at these places. The first patient at this new place, his name is Jeff Cheney. This is now September 2012. Jeff Cheney is a father to 3 and grandfather to 6. He went to Duntsch to try to relieve pain that moved from his shoulder down his arm. And he said, quote, Dr. Duntsch assured me I'd be 100% pain-free immediately after the surgery. He definitely had confidence. So while he was there, he actually, in the surgery, he damaged the spinal cord. He removed some of the spinal cord by mistake. He left him without feeling on the right side of his body. And before this, he had actually asked Duntsch if he had ever lost any patients during a surgery, kind of like the other one. And he was laughed at.
Never during.
Yeah, no shit.
Lose
It's
anybody
interesting.
during surgery.
It's interesting how they were all paralyzed in different ways.
I know.
It's like
That's
you
like
said, he's playing with it.
Yeah.
so crazy.
He
What's that spinal cord?
So after surgery, he woke up in a lot of pain. Dr. Duntsch told Jeff that the pain would go away, that he was being overdramatic, and that he would get back to normal in no time.
Drama queen.
Yeah.
Being a huge baby right now, sir. All I did was mangle you for the rest of your life.
Hey,
I only took
you
a
better
little
breathe
bit.
again.
I only took a little bit of your spinal cord. All right, you got plenty of it.
Huge baby right now, sir.
He asked him why he couldn't
bleeding.
use the right side of his body. And Dr. Duntsch looked at him and said, quote, I don't know why you're this way. Everything went perfect in there.
That's
Yeah.
a you
Perfect
problem.
for him.
Sounds
Yeah.
like a you problem.
Yeah.
Operator error.
No empathy. None.
Jeff Cheney had 10 additional surgeries to try to correct the damage, but has never been fully successful.
Still uses arms, though?
One.
He did.
The left side, right?
He did regain, after some of the surgeries, he did regain the use of his whole body again.
Oh, yeah.
Oh, okay, good.
but he still cannot do certain things. He said, and I quote, "I learned that if I walk and swing my hip, I can move my leg." He's not actually. Yeah,
no,
he's
that
not
doesn't
actually.
sound like he's better. Yeah, no.
So the next patient.
No.
There's 38 of these. Strap in,
I can't do
Em.
this.
Is
Can't
there
do
really
anymore.
38?
No.
Oh.
Tex Muse, December 2012. He had degenerated disc disease in his back. Duntsch took x-rays of him and told him that he needed immediate surgery, and it was scheduled for 3 days later.
That just made my stomach drop because I know that degenerative disc surgery means that everything is way easier to break down.
Yeah.
just made my stomach drop.
No shit.
This man is how old?
He was a young man. I can't recall how old he was, but
You have
he was
easy
younger.
to break bone syndrome. I'd like to
He
go
was like
break all
21
your
or 22. Yeah.
Turn your bones into
Did
dust.
he start doing fly hands immediately? Easily broken bones, you say? Don't mind if I do.
Let's get you in 3 days. Is that good? Yeah.
Doing right now. What are you doing right now? Roll over.
I got
claw
time.
hammer.
He actually had read about Martin's death one day before his surgery, and he called Dr. Duntsch to ask him about it, and Dr. Duntsch cussed him out.
What?
Yeah.
Oh,
So he
immediately
said-
He's like, he's
canceled
right
surgery
here. You
then.
want to
Yeah,
talk
I'm
to
done.
him?
I'm done. You gonna curse me out for asking about someone you killed?
Yeah.
I read in the news he killed a guy. Fuck you, dude. Oh. Okay, never mind. Sorry.
Fuck you, dude. You're
Yeah,
a
I'll
pussy.
see you tomorrow, 8 o'clock. Never
Yeah.
mind. We gotta go.
But so this one is kind of different in the fact that during the surgery, Tex had an actual legitimate reaction to the anesthesia. While he was going under, he began throwing up profusely.
Okay.
Duntsch had absolutely no empathy and told the anesthesiologist to hurry up and put him under, as he was still barfing.
You can't do
Well,
that.
he's pausing him out of his playtime.
Yeah.
That's
There's
true.
something
That's
in
true,
between
yeah.
now and I can't play until you knock this piece of shit out.
The only reason we know
What a
this is
fucking
because
psycho.
Tex, the patient, actually heard him say that.
No.
What?
Yeah, because he's
He
not
doesn't
under.
care.
Because
if
he wasn't under.
I don't care if he hears
Yeah,
him.
he had a reaction and it wasn't.
You have
in
to
effect.
stop everything.
You know what's sad? At that moment, he knew, oh, fuck, he did kill that guy, and he was out. Like, that's
Right?
terrifying.
Oh
How
my
horrible.
god.
That moment, he was like, fuck me, no, please. And he was
was
I
done.
don't want to think about it.
Yeah.
Oh,
Jesus
fuck.
Yep.
Christ.
So-
Tex, wherever you are, buddy.
Dude, I'm so,
I know,
yeah.
man.
Yeah, that sucks.
He
I'm going to send
actually.
you wine on your birthday
Yeah.
every year.
I know,
the rest
right?
of your life.
So, Duntsch actually left, again, surgical hardware floating between the spine and the muscle tissue.
Jesus fucking
He actually never touched the area of the back agreed upon for surgery. Muse woke up in considerable pain, but Duntsch actually convinced him that it was normal, like the pain he was feeling was normal. And he prescribed him so much Percocet that a pharmacist actually refused to fill the prescription.
Oh my.
Because he was like,
so he stayed in pain.
he was like, absolutely not. This will kill him. He wanted to give him 2 Percocet every 2 hours. I don't know what the dosage was.
not that.
Not 2 Percocet every 2 hours. No.
Take these till you don't feel nothing.
And so
Yeah.
I need you to be
Yeah.
you can
dead.
you can
Just take the whole bottle. Why
just
not?
take the whole
He-
bottle.
When the whole bottle comes, just tip
Yep.
it back.
Yeah.
Sit in the tub, turn some music on.
he
okay,
eventually
good.
did get a prescription that was okay with the pharmacist, and it was still really high. And he actually got addicted to opioids because of this. So yeah,
Damn it.
he
That's
lost
so
his
common.
job, lost his wife, was like
Is
horribly
Tex-
addicted. Yeah, Tex, poor Tex.
I just wanted to confirm that the normal dose for a person who's just had surgery is
It's like
2 tablets.
yeah, but it's every
At
6
maximum,
to 8.
every 6 to 8
Right.
hours.
Oh, yeah. Also,
Yeah.
he was. Yeah.
2 every 2.
Yeah.
2 every
Maybe
2.
somewhere for him and then somewhere for the duck. Like,
Go pick this up. Come back.
come back,
Yeah.
half
Split it
for
with
me. Get out of here.
Let's just party.
And here's how Percocet works. Pain relief is felt between 30 minutes and 1 hour. The effects are felt for 4 to 6 hours. The half-life being 2 to 3 hours.
Yeah.
So before the half-life of the medication's even worn off, I want you to take another one.
So this next surgery, Jacqueline Troy, December 2012. This is where I want you to explain some stuff to us here, Rick. During this surgery, Troy's esophagus had been pinned under a plate near her spine, and Duntsch had actually poked holes in her trachea.
Yeah, I'm made of questions. Is he coming through the front or the
I
back?
don't know. He cut off into one of her vocal cords.
What was the surgery?
I think he went to the front.
I think we all know what it's supposed to be.
Supposed to be a
Another
spinal
spinal
fusion.
stuff.
Spinal stuff.
Okay, all right. Whatever. He's going through the front. He had to be to do.
He
any
had
of that
to be,
damage. To
yeah.
do any of that damage. He was
Yeah,
going through the front.
yeah.
All right. And you said the esophagus was found pinched in between.
It was pinned under a plate near her spine. Yeah.
An orthopedic plate.
Yeah.
Like one of our pieces of hardware we put in.
A piece of hardware. Yeah.
Isn't your
How would
esophagus
that-
pretty big?
It's pretty big.
It's pretty big.
It's also easily recognizable by anyone who's ever read an A&P book in their life.
Yeah.
So the way that your body is structured from front to back, if you reach up with your index finger and touch your Adam's apple, okay, that's your trachea.
Yeah.
There we go. Directly behind that, almost like they're standing in a line, is your esophagus and then your spine. They're big open pipes,
Yeah.
big hollow structures inside your body. For the procedure I mentioned earlier, cricothyrotomy, the trachea is the easiest to identify because it has a set of cricoid rings on the front. That's what you feel, these little doodle-doodle-doots when you reach up and touch your throat. We cut through a single layer of soft tissue, skin, and a slight barrier of some muscular tissue, but it's not activatable, I guess it is if you swallow, but whatever. My point is it's less than a half-inch thick. So we're trained to cut through that tissue, identify with our fingertip, by the way, the cricoid rings, which feel indistinguishable from any other part of the body. That's why they let paramedics do this surgery, because they're so confident you can't fuck it up. So you reach in and you identify those structures with your fingertip, and then you poke through them with the scalpel to make a little hole for your airway, and then you put your tube in. A cricothyrotomy is my way of bypassing your entire head to get to your lungs so you can breathe.
Yeah.
Something is blocked, you're choked, there's a piece of roast or a dinner roll or something, I can't get it out. So I'm just going to go under it and make a new hole that goes straight to your lungs. For him to have done how many surgeries in his fellowship? Even if he did hundreds, that means he's seen 100 tracheas.
Yeah.
He knows it. He's seen it. He's seen 100 esophaguses. He's moved past those structures. Now, I know it sounds kind of gross, but the esophagus comes down and attaches to your stomach, and the trachea, of course, goes down and goes to your lungs. There's room in your body to move those to the side by just pulling everything up with it. So if I want to move it out of the way so I can see your spine, I just take that structure, move it up into the left or right, however you're going to do it, and then it's out of the way. Now we're talking halves of inches to get all the movement you would ever need to not attack those structures. And they're very easily identifiable. I would go so far as to say that they're violently different. Even if you don't recognize ischium, which is the fibrous tissue that connects lungs to muscles and connects internal organs to muscle walls or anything like that, once all that's prepped and cut away so you can get to the spine, it's just an open spine.
Okay, let me ask you this. If you cut an artery, let's just say it's severed in half, how long would it take you to bleed out?
It would depend on your heart rate and pressure, and of course your overall total volume. But arterial bleeds are the most prominent because, depending on the vessel, of course, itself, like we're not talking about the superior vena cava, or not the vena cava, but we're not talking about the aortic artery, or maybe like a femoral artery, or one of the more distal.
Right.
But I know that a femoral bleed left unchecked will place a patient in decompensated shock in 10 minutes.
We're talking about the artery that runs next to the vocal cords.
Carotid.
Right. That was severed.
How?
That was severed along with one of her vocal cords was severed.
Hey, it's something he'd never done.
That's inside the trachea.
Something
new.
Something
That's
new.
inside the trachea. He would have to have deliberately, or just be, good God, if he didn't do it deliberately, then he's just flailing around in there. He's just cutting wild.
I think we kind of believe at this point he was
At
doing
this
it
point, I
deliberately.
think we have to say.
Yeah.
He has to have been. So she was left barely able to speak above a whisper. She did survive.
Good for her. I hope she looked him in the face in court.
She actually had to be sedated after her surgery for 2 weeks. 2 entire weeks. She had to be knocked out.
Well, yeah, there's
Because the
too
damage
much.
was so bad.
The muscular movement can exacerbate.
She had a feeding tube. She had stuff was getting into her lungs. They were afraid that she was going to
Aspirate her baby.
Yeah. And so, despite these mishaps, Duntsch was retained by Southampton when new owners brought it and renamed it University General Hospital.
He brought in a lot of
Bill
money.
is done with this.
See, so that has to have been
the world.
Well, that
man.
has to have been
How
an
do you
administrative
not-
overlook.
No.
They have a massive roster of people.
Yeah.
So they just looked at a list of people and said, all right, keep the neurosurgeon.
Yes.
He makes the most money.
What?
He makes the most money. Keep
had
the
to be
neuro guy.
sedated for 2 weeks.
They didn't look into
You
his
can't look at
surgery.
that.
They're not gonna
They
look-
didn't look into his surgery. That's
How
what they're
administrative-
gonna.
No one look into his surgeries?
No.
Like zero?
No, they don't.
Administratively,
All
they
they
don't
do.
All they.
Fuck is wrong?
I'm glad.
All they do, all they do is look at that online record to see if anything has been, or if they needed further, they could call the medical board, but nothing was reported there. So to them, his record's clean. Why would you call and go, I need to know if there's any, like you wouldn't unless you knew specifically that you needed to.
I need to call the police, and this man needs to be arrested because I have a person that I've sedated for 2 weeks.
Yeah.
And that's what makes you better than all those
I
motherfuckers.
am not better than those people. I would just,
No, that just makes him a regular, normal person.
Yeah.
Yeah, that's true.
that should be
So-
the basics.
You've reached the end of our episode. All suspects are innocent until proven guilty in a court of law. Join Raven next time on the Sirens Podcast.
Do we have an outro? That's our outro, isn't it?